Hi, everyone. Thanks for joining us on a Wake Up with Wasatch webinar. Today, we're going to be talking about the brain and addiction and treating addiction as a psychological illness. We have Rich McDonald, our Wasatch Crest Clinical Director, to present. If at any time you have any questions, feel free to type them into the control panel and we'll make sure Rich gets them answered. And then there's also a collateral packet with a bunch of information about our programs. So feel free to download that straight from your control panel. I will let Rich take it away.
Perfect. Thanks, Kayla. Thanks everybody for being here. This is a topic that I spend a lot of time talking with our clients and family members, and so I'm glad we could do this today. So let's first, what addiction and, as a psychological illness or disease model looks like. And there's a lot of topic and research on past few years, which has been really good with the stigma around addiction. I think as people get more and more educated and have it. When we're looking at defining something as a disease, we want to look at the components of the illness. And when you really look at addiction, we know for one thing it changes the brain biologically. We can MRI and look at the brain and see that the neural pathways are firing differently than they did in a person that is not in active addiction. We also know that it has a predictable path. So if addiction is left untreated, we know it'll have certain outcomes, and ultimately it's life-threatening or will end in death if it's not treated. We get some resistance from time to time from family members not really understanding how addiction works, in spite of the evidence around that, and watching their loved ones make choices or not, maybe their loved ones' actions, and the severity of the addiction gets worse and worse. And so it's really important to families and those suffering understand, addiction. And it's not something that we share to take away any accountability for actions, but it's something that we help them. And on some level, I do think it is a relief, especially when we talk a little bit more abstinence from drugs and alcohol. There's also research and pretty concrete evidence that the brain does begin to heal itself, return to the state it was prior to the active addiction. So how does the addiction? All of us as human beings have which is essentially our stop system in our brain, or we can call it the midbrain, which is kind of our fight or flight area of the brain. And those two areas of the brain are changed through active addiction. So the midbrain is the part of that gives us to, run from a tiger or stand up and when we feel threatened. It's the same part of our brain that tells us to eat for survival. It's really that base animal part of the brain that we all have. And evolutionary terms, that's the first part of the brain that really developed. And it's the part that is responsible for our survival in high risk situations, is our midbrain. We use that part of our brain when it's, for lack of a better term, it's the brain that really tells us, hey, this is a threat and we need to respond. And we've all heard the fight or flight, or fight, flight, or freeze. That's all driven by the midbrain. And as our brain develops and we adults, women's brains fully develop a little bit sooner than most men's brains. In their 20s, fully developed, usually somewhere, it depends on where you live, between 24 28 years old. That prefrontal cortex is the last part of the brain that develops, and the prefrontal cortex is the stop system of the brain. It helps us with impulse control. It is the part of our brain that says, wait a second, that's not a wise choice. Maybe I won't do that. It's really helps us make better decisions and control our basic impulse. And what we see with a functional MRI, and we can watch the way the brain responds to stimuli, is that prefrontal cortex in somebody who's not addicted to a lot of activity. We can watch those neural pathways fire, and there's less in the midbrain. As somebody becomes more and more addicted to drugs or alcohol, or even other activities that release dopamine in the brain, the feel-good chemical in the brain, the neural pathways in the prefrontal cortex, that impulse control, essentially. And the midbrain, tons is occurring there, like more than somebody who is not addicted. That part of the brain, that midbrain, is the same part that tells you to run from a tiger, is the same to use drugs and alcohol. And when you look at it that way, it really explains how what it is, and a loved one or somebody that's suffering, the person that's suffering from addiction, or does things that are totally out of character. I'm a person in long-term recovery. I think about some of the actions that I took, and it seems surreal many years down the road, that some of the choices that I made, in spite of the consequences, even when I stopped and thought, okay, if I do this to happen, I still lacked the impulse control, and I continued along the path of making the poor choice that I knew would not end well. That's really important for sharing that, with those suffering and family members. A little bit about how addiction does change the brain, and we can see it. It's a change. And I do want to say that when somebody's abstinent from drugs and alcohol, are getting good treatment, the brain does return to normal. We see activity that's occurring in the midbrain becomes less and less in the prefrontal cortex. The pathways rewire themselves and start to heal and go back to normal. One of the best ways I've heard it put, we all are looking for this level of, I guess, or homeostasis in the brain, and the way we fit, with people in active addiction, the brain's tilted toward pain, and we're always trying to get that back to the brain tilted back towards the feel good or the heart. And once it's tilted towards the pain, drugs are the solution towards the happiness part. Unfortunately, it's really unattainable with drugs and alcohol. We can get people in treatment and keep them abstinent. The brain really turn and tilt towards that happiness part of the brain, and that place where we feel most comfortable and at peace. It's super important that we keep people, we talk a lot about within the treatment world of keeping people, length of stay and level of care and transitioning to normal life, because we know that the longer they're in treatment, generally the better the outcome. Environmental and genetic risk factors for addiction. So this is something that we think a lot about as well. So there is definitely a genetic a genetic predisposition to addiction. If somebody's parent or grandparent suffers from the disease of addiction or alcohol, we know for sure, there's about a 50-50 chance that there are that genetic predisposition to addiction. And once that's activated, it's difficult to get that back in check without formal treatment. We all know somebody who, can have a glass of wine a day, and it's not something that even is appealing to them to be drinking on a daily basis. For others with that genetic predisposition, it doesn't take much. Once drugs or alcohol, it can easily gain traction, and it almost activates that addiction. And we also talk about environmental factors. Somebody has the genetic predisposition, but maybe is never exposed to that world of alcohol, may never activate that addiction, and could go without experiencing that. So talking about that and helping, for me, learn and understand that they have a chance that they do have that genetic predisposition, and hopefully supporting a healthy, happy environment can make a difference. But I do want to say that, we talk, there's a lot of factors. We see so much trauma, in our clients that come in that we're trying to help and turn around and live a healthy life. But there is absolutely people come from great homes and parents that did most things right and a really good environment, and they still suffer from addiction. So you can try to create the perfect, with as few risk factors as possible, but the reality is we'll still sometimes suffer from the disease of addiction. So it's not all as black and white as we'd like it to be, I think, and understanding that is important as well. I know oftentimes parents and loved ones find themselves, blaming themselves, their loved one's disease, and that's not the case. We can do so many things right and still have, somebody suffer from addiction or alcoholism. Now, combating the perception as a choice is where the whole, disease model comes, like helping people understand that somebody in active addiction may have made a few poor choices along the way early on, but once that disease is activated, that choice is once the brain is in full addiction, choice is kind of a non-factor, right? I always tell people that once we have some sobriety, we start to get that choice back, but in active addiction, we've really given that choice until we try to get some help and start working on ourselves and live a healthy and happy life. I think one of the biggest things, there's a great documentary called The Anonymous, and it speaks directly to, people in recovery advocating themselves, and it's a personal choice of what people choose or want to share with but the messaging around that is really important. I think helping people see that there are people in recovery all around them is super important. My experience is most people have a loved one or some connection to somebody that is currently suffering from the disease of addiction or is in long-term recovery. And educating is one of the most important things we can do. We see it with the opioid epidemic, the recent COVID pandemic. There's been so many things that are just putting fuel on the fire for addiction and helping people understand that it is a disease, but there is hope. There is a way to treat that, and there is a way to get back to a healthy and happy life. More important. I'd encourage everybody to check out that documentary, The Anonymous. it's a great way to look at kind of our social responsibility of speaking up and being transparent. The fact that we are people in long-term recovery. Does anybody have any questions, Kayla?
I'm not seeing any questions, but if you guys do want to learn more about Wasatch Crest, you can download that collateral packet, or Rich, if you want to slide to the next slide. Oh yeah, there it is. Sorry, it was that one. There's our website, wasatchcresttreatment.com, and our 24-hour admissions phone number. So yeah, thank you all for joining us, and be on the lookout for announcements about our upcoming webinars. Thanks, Rich.
Thank you.